Hi there, my name is Kayla Lafferty and I'm doing my presentation today on the knee. Most of the information I've gathered for this presentation is from our anatomy course, but I've also gotten a little bit of my information from a couple of the other courses I've been taking this semester. So, as we know, the knee works alongside with our hip and ankles to support our weight and keep us all moving. Each of these joints function interdependently of one another. This basically just means that what happens to one joint has an impact on the others. There's a couple of things that make the knee more susceptible to injury, such as a large range of motion, lack of muscle mass in comparison to the hip, where there's lots of muscles there supporting it, and lack of strong ligaments, again compared to the ankle that has several. In this presentation today we're going to cover the movements of the knee. We're going to touch on the anatomical structures. We're going to discuss some of the common injuries, as well as talk about some exercises and stretches that we can do to keep our knees functioning and healthy. So, the knee is a pivotal hinge joint, as you can see from these pictures. Just acts as a hinge there. The specific movements for the knee, the main one is flexion and extension, but there's also a little bit of rotation that can happen. So the flexion and extension, that is the hinge part of the knee. It occurs in the sagittal plane, which is the plane that splits your body in half lengthwise. The muscles that allow the knee to flex are the plantaris, which is down by your ankle, the gastrocnemius, and that one's just right behind your knee, as well as the bicep femoris, semimembranosus, and semitendinosus. These three right here make up the hamstrings. The muscles that extend the knee, rectus femoris, are your quads, and the vastus muscle groups, which are just the muscles right above the knee. Obviously you can't rotate your knee when it's holding your weight, but if you weren't having any weight on it, you can rotate it a little bit to a maximum of 90 degrees. This movement happens in the transverse plane, the one that splits your body in half through your stomach. And the muscles that do this, the medial rotation, are the semitendinous, the semimembranosus, and the popliteus. And the ones that allow the knee to rotate outwards is the bicep femoris and the sartorius. And here's a fairly detailed diagram of the knee. We aren't going to focus on all of them. I'm just going to touch briefly on some of the main parts here. There's 6 main components. We'll start with the bursa. There's a couple right in here. It's just a fluid-filled sac that essentially just reduces friction and helps provide some padding. We also have a couple of ligaments going on through here, but we'll focus on that in the next slide. The meniscus, it's this one that goes right in here. It reduces friction, and it also increases the surface area and helps to spread the force out throughout the knee. Obviously we have the bones for support. There's the tibia coming up right in here, and the fibula, this little one coming up, and the femur meeting right in there. We also have fat pads that aren't on this diagram. That's basically just what they are, fat pads. They provide some extra padding in there. And we also have the cartilage that comes down right in here. And this just goes over what we just discussed. And here's the 7 main ligaments. We have the patellar, tibial, fibular, popliteal, and the anterior cruciate and the posterior cruciate. And here's a diagram here. We have the fibular collateral ligament coming down here, and it attaches to the fibula. It provides some medial support. We've got this ligament coming up right here. That's the tibial collateral ligament. Makes sense because it attaches to the tibia right down there. You can see these 2 ligaments crossing right back in here. You have the anterior cruciate ligament that crosses in the front, and then the posterior cruciate ligament that crosses in the back. And the 2 ligaments that aren't listed here, the patellar, which just offers some support in the front, and the I think it's a popliteal ligament. And there's a couple of those that offer some support in the back. Common knee injuries. I've had the pleasure of experiencing all 3 of these, which is kind of why I chose them. The first, most serious and the most painful was the anterior cruciate ligament tear. The most common one is in young athletes, mainly because it's caused mostly by hyperextension, pivoting, cutting, any quick movements, and change in direction. So lots of young athletes participate in sports that require all of these things, and so ligament tears are quite common. The treatment, there's a couple of options depending on the kind of person you are. Obviously everyone's going to rest it, ice it, elevate it to get rid of the swelling, but depending on your level of activity, the doctor may recommend that you just brace it up and carry on with your lifestyle, and hopefully that will fix it. Or there's surgery. Once you tear your ACL, it's not going to repair itself, so there's a couple of different ways to do the surgery. I think the most common one now is taking part of your hamstring through the back and then pulling it out through the front, and I don't know what they do in there, tie it off, I guess, make it into a new ligament. Another common knee injury is the patella dislocation or the kneecap. It can dislocate either lateral or medially, but lateral dislocation is the most common. And while I was researching this topic, I found out that women are the most commonly affected. And the main causes of this are if you change direction when your foot is planted, or muscle imbalance, which is what mine was caused from. And the treatment here, obviously rice, as with most injuries, you want to get that swelling down. X-ray is what I found. I don't know, X-ray isn't always conclusive about whether it's a dislocation or not. I just threw that in there because that's what this lovely website said. Also there's braces, but the most effective one is doing some knee strengthening exercises. And we also have torn cartilage and meniscus. This often goes along with ligament tears. Lots of times if you tear a ligament, you're going to tear your meniscus as well. Unfortunately, as with the ligaments, it can't heal itself, so once you do some damage in there, it's not, you aren't going to fix it. As you can see, the causes, knee twisting, changes in direction, degenerate tears. It's most common in young, active individuals that participate in sports that change directions, that kind of thing, and the elderly, just mainly because your body's breaking down and their joints just aren't holding up quite as well as they used to. And like I mentioned, there is, once you tear a meniscus, that's it. It won't repair itself. So there's a couple of options depending on the severity. There's just pain medication. You can do some exercises, do some joint aspiration to provide that extra padding in your knee, or there's surgery, which just goes in and kind of shaves it down a little bit and reduces the friction that's going on in there. Knee exercises. These are helpful to maintaining proper muscle balance and offering good support for your knee. So the big muscles here that are supporting the knee are the quads. And so I'm going to do a demonstration of a proper squat, and then I'd like you to try it for my audience. This is my activity, and I will evaluate how well you're doing it. So as it says here, you want to keep your knees aligned with your ankles. She's doing pretty good here. You don't want your knees to go forward past your ankles there. And you want to keep your back straight. So you want your knees about shoulder width apart. Make sure your weight is spread out equally over all your feet. And just slowly go down, keeping your knees over top of your ankles. And then slowly raise. And our next exercise is the hamstrings. We've got, those are that group of muscles in the back of your leg. So as you can see here, you're basically just making a platform there with your arms down at your sides to help keep you balanced, and then your feet on an exercise ball. You want to have your feet close to the top, your arms down at your sides, and you want to push your butt up to the ceiling and make a nice flat platform. Once you can hold this pretty well, you can make it more difficult by stretching your legs out and bringing them back in. And knee stretches. I T-band. Unfortunately, don't have a foam roller to demonstrate this, but especially if you're a runner, IT bands tend to get pretty tight, so it's good to stretch those out. It's just the muscle right along the outside of your legs, and you just take a foam roller, lay it on the ground, and just kind of stretch it out. You have quad stretches. We've all done these. Bring your knee back behind you and just gently push until you can feel the stretch in your quads. Same with the hamstring, toe touch. We've all done those. Go down, touch your toes, and the calf stretch. You just pull your toes up. So, in conclusion, we rely on our knees to support us in all of our weight-bearing activities. They're very important. Even though I've had all my injuries, I take it for granted when it doesn't hurt. So, it's pretty important for us to understand how our body works and how our specific joints work, so we can make an effort to minimize our chance of injury and to keep us healthy for as long as possible. That's all. The end. Bye.